In a health advisory to passengers, the Health Ministry said close contacts of the COVID-19 case will be placed under quarantine or health surveillance. The rest of the passengers, however, can go about their usual activities but must monitor their health for 14 days from the date of disembarkation. They'll also undergo a PCR swab test at the end of the monitoring period. Well, are these measures enough, though? So joining me now to answer that question is infectious diseases specialist Dr. Leong Ho Nam from the Rofi Clinic. So, Dr. Leong, the majority of the passengers will need to take an antigen rapid test when they disembark, and after that, they'll have to monitor their health for 14 days and essentially are allowed to resume their usual activities. No PCR test, no 14-day quarantine. Do you think those are sufficient curbs to prevent the virus from spreading to the community?
I think so. Let's look at the facts. The chance of anything being truly happening, being a COVID infection, is extremely remote. Look at the patient. He's elderly. He came in for diarrhea. He had no respiratory symptoms. We know the first swab was negative, but we do know each test there is a limit. There's a sensitivity issue. In fact, if the person had it a long time ago, then the chance of this being positive will be slimmer. So when he went to see a doctor, he had diarrhea, he had no respiratory symptoms, no loss of smell, no cough, no runny nose, nothing at all. And they did it as part of protocol. It turned out to be positive. Number one, we do not know if this was a recent positive, as he just acquired it recently, or it was a long time ago. Number two, we don't know if this is a false positive. Mind you, kids can have false positive results. Number three, we want a second confirmation. And number four, we want to do a blood test to see whether he has antibodies. If he has antibodies, we know he has immunity. This man had it a long time ago. In fact, then he'll be safe. So going forward, still lots of unknowns, but I'm not worried because the ship has on board them their own Trace Together app. This is to overcome the ship structure with all the steels and whatnot. And if we were to come close in contact with anyone within the 2 to 3 meters radius, you will be notified. That's the purpose of the Trace Together app. And honestly, this is being carried out to perfection on board this cruise liner. Why? Because practically everyone, 100% of them, will be wearing the wristlet, and this would actually help ensure that everyone who come in contact will be notified. This is the most important safeguard that we have not had since the beginning of the outbreak until now. Even then, we don't even have 70%. With this, we can identify those who are truly at risk and then discard those who are not at risk at all. So going forward, that's the way, and in fact, that is the new normal. With the Trace Together app, we are going to identify people more accurately, and we lock down the affected people, but not everyone. And then for the rest of the people, watch out for symptoms. No symptoms, well and good.
Well, Royal Caribbean said the ship was deploying enhanced sanitation on board and is scheduled to actually set sail tomorrow. Is that a wise move, you think? For instance, could a crew member be infected but asymptomatic and then he's set for another cruise tomorrow?
Good question. I think the ministry will have considered such a unusual circumstance. Could the crew member be the one that spread to him on board the ship? Possible. I'm very sure they'll do their own testing. They'll do their own assessments of all the people on board the ship, and they will disinfect the ship totally cleanly. Mind you, I've looked at the ship's protocols, the availability of their air filtering, and the measures which are taken on board the ship is much, much tighter than any of the buildings which we have. So this tells me that they are really taking the matter seriously, they have measures in place, and they will control any outbreak. I think this is something which we have to remind all the listeners to this and the viewers of this program. This will be the new normal. No country in the world, be it South Korea, Hong Kong, Singapore, or China, when they open up their gates for other people to come in, when they loosen the control, all of them had new cases pop up. This is unavoidable. The virus is so prevalent, it's found everywhere. So we're going to get a pop-up of 1 or 2 cases every now and then. It is thus not for us to worry because we have overcome this before, wearing masks and safety distance. It is rather for us to cooperate. Do we have our Trace Together app on the phone or the dongle? Bring it along, do your part, open up Singapore, and we will be safe.
Right. Well, earlier you already touched on the COVID-19 patient who was detected on board. Now, this passenger tested negative when he took the mandatory PCR test prior to boarding, then a positive while on the ship. So, doctor, what are the possible scenarios that could have resulted in this? Possibly, maybe he had a low viral load when he took the first PCR test?
Ollie, that's spot on. I suspect he probably had an infection a long time ago. But it was asymptomatic. Despite his age, he survived through with hardly any symptoms. And when you first tested him, the viral load was so low, he failed the lucky draw. That means he didn't pick it up, the virus at the first swab. But the second time round became second time lucky, it picked it up. So I presume it is a positive case, but it's been such a long time ago, the viral load was very low and hence was positive. Bear in mind, the machine on board the ship may register a false positive. You're not talking about a solid piece of machine which is available in the Ministry of Health laboratories, but something which is more portable, which may carry with it false positive risks. Number 3, let's not discount it. Let's be perfectly honest. One person on board the ship could have spread it to him, and he fell sick manifesting as diarrhea. Possible. Very unlikely because all the crew would have been checked, and mind you, other people on board the ship will fall sick as well. That's not the case we're seeing, and the incubation period is a little too short. So in all likelihood, that is unlikely. We will know more when Ministry of Health actually investigates that individual, do a second test for confirmation, see the viral load, and do the blood test. We have a clearer picture then, and we will be able to reconstruct the whole story properly.
So from this incident today, or maybe even before this, where do you stand on this Safe Cruise pilot scheme? Do you see this case as a necessary test of onboard safety protocols, or do you deem that the risks are too high in the first place for this pilot scheme to work?
Ollie, I love your question. It is the right thing to do. This is a pilot program. And given the circumstances, we should still continue at this point in time. Unless we have information on the patient, which I'm not aware of, based on the current facts, we should still carry on. This is the way in which travel or other cruise lines can reopen again. And this is the model. This is not going to be Singapore's Diamond Princess. In fact, this will be the diamond model in which cruise liner and other travel facilities reopen up. You see, if this works, we can similarly do the same for other cruises or other programs. And if this works, the same model will be explanted out and the whole Singapore will be in this model as well. Everyone has a trace together, everyone gets a routine test when they fall sick. This is the model going forward to open the economy and yet be safe for everyone. Mind you, in the next few months, we're going to get the vaccines coming up. This is going to be yet another layer of protection for us, for Singapore, and for the world.
Well, as always, thank you so much for your insight, Dr. Leong. That was Dr. Leong Ho Nam, an infectious diseases specialist from the Rofi Clinic at Mount Elizabeth Novena. Keep abreast of this developing story over at straitstimes.com.